I'm happy to introduce Flashpoint Healthcare, and this webinar is going to be concentrating on the navigation of the current benefits for the workplace. Today, we will hear from an esteemed group of leaders in human resources / benefits world. We're going to start with Steve Glick. Steve?
Good afternoon, everybody. I cannot believe it's almost 37 years since I started working with chambers of commerce across the state of Connecticut. And all of you are very positive, unique people that have done a lot over the years. But now there's a crisis going on more than ever. And most of you have been facing that under the terms of COVID. And, but what it has on the positive side, a lot of things have happened positively. New technology has been created, implementation of new ways of taking care of yourself. We're all familiar with telemedicine, telephonic consultation, and on the other hand, 99% of the companies I've talked to have only looked at health insurance as a cost item, premium only. They have not expanded their knowledge of the other valuable proposition that could be taken advantage of by understanding tax laws, understanding other types of products, the word using voluntary programs, understanding pharmacy, understanding the value proposition of dental and others. So what we have done is built a 5-stage program called Flashpoint Healthcare that allows us to help you in a variety of ways. The collected information put together will change the whole dynamics of healthcare as you know it today. Some of our clients in the small marketplace that are companies of 20 or more have gone into plans called captives. The captive is a whole different dynamic of health insurance where you own your health plan but share risk with many other companies, and you withhold 30 to 40% of those costs in your own bank account. There's a lot of other residual factors that move around that, and we also know the traditional programs. MET plans, minimum essential coverage programs, can be utilized with the programs that we are outlining today. The key is for you as a chamber member, and as we did years ago, got you all together to think as a collective unit, building your own independence, but being creative and thinking out of the box to perform good things for your company. We will be able to save your company 20, 30, 40% of the costs that you are spending today by taking advantage of the programs that we are going to outline for you. I was waiting for, but I will announce, part of the program for all chamber members is, with no cost to you at all, we will provide you an additional prescription drug program, a different card that you could compare against your own drugs. 65,000 pharmaceutical organizations participate, and we have seen a major reduction of costs. The other side of it, with no cost to you, being a member of the Milford Chamber, will be a drug card for purchasing foreign drugs. Again, a different approach. We need to help find all of these issues collectively together to make sense of a new marketplace, which we call Flashpoint Healthcare. All of the collective things you're going to hear today will build a whole new direction for you. So it's great that you're a member of the Milford Chamber of Commerce, and I'm going to now introduce David Middlemist that will share one of the most interesting solutions that 99% of all of you could take advantage of, and that's pre-taxing dollars. And hopefully that alone helps you hear a new spin. So Dave, I want you to share Prodigy and why it is an important value proposition to all size companies in the chamber marketplace.
So looking at the problem that we have in this country regarding healthcare and its costs, 44% of the population has chronic health conditions. 50% of the costs of healthcare eats away at business profits. That's pretty heavy. 78% of those people, those 44%, account for 78% of healthcare spending in this country. Obesity alone costs this country $117 billion a year. Absenteeism and the loss of productivity due to poor health costs, depending on which research you look at, as much as $1 trillion. So what are we going to do about this in such a non-transparent marketplace as our healthcare industry? What we've come up with and what we've designed is a predictive, preventive, personalized participatory wellness program. Our program has been validated by GE Intel Healthcare to be between 85 and 93% accurate in predicting the onset of symptomatic disease within a 3 to 5 year window. Because we're able to do this, we're also seeing in that same 3 to 5 year window a reduction by 25% of healthcare costs in those populations. That means that we're also seeing an increase in positive outcomes by as much as 25% at a minimum. So we know that we really do have an impact on where we go with population health with what we do. The greatest thing is it's personalized. Each individual receives their own personalized dashboard. They have access to registered nurses, master's degree nutritionists, and dietitians for their healthcare coaching. In that healthcare coaching model, we can also bring in their physicians and their disease specialists if needed. So we're actually closing the care gap within our program between medical professionals that are working for the interest of our program participant. The key to this is that our participants are actually learning about what their personal health is, and they're learning better ways of communicating with their caregivers, as well as easy and more efficient and effective access. So instead of going to the emergency room or to an urgent care, we're getting them into primary care doctors, or where needed, we're getting them into their specialists. All of this saves money. Right? Now, this sounds like a great thing. It's even better. What we've done is we've created a carrot and a stick. We use a pre-tax contribution, which reduces their taxable income. Therefore, you, the employer, for the first time ever in benefits, actually saves money on the FICA because of that reduction. The employee then participates in our program and receives Section 213D compliant care, which means the care is reimbursable. They get that money back in their after-tax paycheck as a medical reimbursement. So they have a tax savings that's realized on those untaxed dollars. We refer to that as the benefit bank. That benefit bank is what they can then use to purchase voluntary benefits to help them and themselves and their families purchase voluntary benefits that help them in the event that they have an unplanned medical expense or out-of-pocket expense. Right? All of this is done without affecting their take-home pay. So they can get the benefits that they need for the interest of themselves and their families, get better health information, and take home the same amount of pay that they did before implementing our program. One other added benefit we have actually a virtual ER in our program. This is far beyond what typical telemedicine is, and it's at no consult fee. Our doctors can actually do labs and imaging and make diagnoses based on those labs and images. And then if needed, they can help with the coordination of care within that patient's community. So we're actually able not only to give them simple diagnoses, but we can make other diagnoses, prescriptions, and then also help them find the care that they need, whether a disease specialist or whether it may be they're a primary care specialist. Right? And all of this is done with a savings to both the employer and the employee in our program. So Steve, I'll throw it back to you if anybody's got questions. Or
So here we have Steve Riggs, who's the founder of National Health and Wellness, and he brings years of experience to helping businesses create better healthcare options while lowering costs.
Okay.
Mr.
So
Riggs?
thank you very much, Simon there. And thank you everybody for joining the webinar today. I'm going to go ahead and share the screen here. but I do want to start off by saying how proud we are to be a partner of with Steve Glick and the Flashpoint program and Prodigy and Lee at Benecare. Everybody, what Steve has done here for the state of Connecticut and through the chambers is really, it's a innovative way to be thinking outside of the box in terms of helping businesses and their employees with the rising costs of healthcare. That is one of the major challenges for businesses today. And we're proud to be a part of an innovative thinking company and, you know, being able to bring all of us together. And we all have our certain roles within the Flashpoint program. So there isn't a way that we can't help a business, whether it's large or small or medium, whether they have health insurance in place, whether they are looking to begin a benefits package. We are here to help. There is a way to help. So with that, we are extremely proud to be a part of the Flashpoint program. And, you know, let's talk a little bit about the market trends that companies are experiencing. Some of the employer challenges are the increasing cost of offering medical insurance. It's expensive out there. It's a huge percentage of a business's bottom line. Higher deductibles, co-pays, co-insurance, the cover the rising costs, all right? Attracting and retaining employees without the right benefit mix is a difficult challenge. This program offers a way, which David was just talking about, to go ahead and expand their benefits package to enhance it without affecting the company's bottom line. A happier and healthier employee is then generated. And then, you know, what we do in our role here at National and part of the health of the Flashpoint program is properly communicating and educating the benefit plans and strategies. So we're taking that responsibility off of the employer. You know, when we're sitting down and we're educating their employees, we're going through everything that that business owner does for their employees. A lot of employees do not realize the expense that the company is paying. You know, somebody could be making $25 an hour, but in actuality, they're really making about $35 or $40 an hour because of everything that the business owner is contributing. So what are some of the employee challenges that they're facing nowadays that we can help with? Depleting emergency savings for unexpected medical expenses. If somebody gets hurt and can't work, what are they going to do? If somebody is facing a cancer diagnosis, how are they going to pay for it? How are they going to get the kids to school? How are they going to pay their household bills, right? Our programs and our role really help with that. How are they going to deal with the high premiums and higher deductibles? High premiums and higher deductibles are a part of way of life now. We have people that have a $5,000, $10,000 deductible. A lot of individuals do not have that money sitting in a savings account just waiting to be used for medical expenses. We help with that. Over 70% of Americans live paycheck to paycheck. So think about that. Think about that $5,000 deductible. If you're living paycheck to paycheck, you do not have that ability to go ahead and pay that. We can help. Or, you know, the potential of delaying treatments because of the costs. We all know, we all have family members, we all have friends that do this, right? They are not going to go to the doctor because they're scared of the expense. We can help cover that. And, you know, and for employees, it's the lack of appreciation and understanding of health insurance and the benefits. And that's what we really do help communicate. So some of the plans that we offer, which this is a innovative way, once again, with the wellness program, as David mentioned, you are getting a whole host of options to do. It's unbelievable what the program does. And I implore you to go ahead and learn more about it. Call us up. We'd love to tell you about it. But, you know, he was talking about the telemedicine at no cost. There's a lot of insurance companies out there right now that waived that cost during the COVID crisis. I guarantee you that cost is going to come back, and that's going to be a copay for the employees. It could be 20, 25, 45. I've seen $55 for a simple telemedicine appointment. Utilizing the Flashpoint program and the wellness program through Prodigy, you're going to be able to utilize that without a cost. How valuable is that? How more often are people going to go ahead and utilize that and have that access? They're no longer going to delay anything. So with that benefit reserve that David touched on, that is for each individual employee. So what this program does is, on average, it's going to save the company about $500 per participating employee. For the employee, they're going to see on average $150 as a benefit reserve that they can go ahead and now utilize to purchase voluntary benefits. Supplemental insurance is so important to be coupled with health insurance. The gaps in health insurance are constantly rising, and more of the expense is being thrown back onto the individual. So we talked about deductibles and copays. We have a gap insurance plan that will help take care of that. We have a critical illness policy that has a guaranteed issue ranging up to $50,000 for individuals. Think about that. Guaranteed issue up to $50,000. That is huge. Of course, they can get more, but it's guaranteed up to 50. We have a hospital indemnity plan. We have obviously life insurance. We have disability insurance, which can be boiled down to paycheck protection. If you get hurt and can't work outside of work, how are you going to pay your bills? You're going to deplete your savings accounts. Hopefully you don't have to go ask for a loan or put, bills on credit cards. These are all ways to help keep families and individuals financially sound during their time of need. And of course, we have our accident plans for individuals and families as well. And with that benefit reserve, the biggest issue that we run into when we don't utilize the Flashpoint program and the wellness portion of it is we're working within people's budgets. And those budgets nowadays are razor thin. They're not as much as they used to be. People participating in this program go ahead and they see that the money that they have created through that benefit reserve by participating is 4 times as much as what they would normally spend. So when people would sit down with us and not utilize this program, maybe they're looking at 1, maybe 2 policies that we can couple together and stay within their budget. But with this program, when they participate, they're looking at 3 or 4. They're doubling the amount of protection that they can get. And that is absolutely imperative for today's American that's hardworking and not financially sound. Like I said before, people are living paycheck to paycheck. We've got to help them. And Flashpoint and CIT and everybody here, we've kind of created a way to help cover people. So we talked about some of the employer challenges, addressing the rising costs of healthcare, high deductibles, enhancing benefit plans, attracting and retaining employees, improving workplace morale and loyalty, and communicating benefits, right? Those are the employer challenges. Some of the employee challenges that we talked about are depleting emergency fund savings for unexpected medical expenses. Our policies help offset those bills that you will receive. Dealing with high premiums and higher deductibles, the potential of delaying treatments because of cost. We don't want anybody to have to think about, well, I'm not going to go get my chest checked out because of the costs. And, a week later they have a heart attack. That's not the way the American worker works way too hard to have the health insurance system that they have right now. Having access to valuable benefits without affecting the bottom line. So that right there, that participating in this program, we are providing them a benefit reserve without affecting their take-home pay. So if they are paying for voluntary benefits right now out of pocket, they are actually going to see an increase in their pay because they're going to be able to get the same policies just through this program, not out of pocket. They will not be paying for them out of pocket. And then understanding the benefit offering, that is important. So, all that we need on my end to get started and to start this process off is to get a census from you. All businesses provide us a census. We'll send a template out, you fill it out, you get it back to us. We will craft and customize each benefit reserve for each employee. So when we have that follow-up meeting with you, we're going to be able to tell you what not only your employees' benefit will be, whether that's $150 a month, $200 a month, or $125 a month. But we're also going to be able to give that business owner an idea of what their potential savings is if people participate. On average, $500 per participating employee. You can see how quickly that can add up to a company's bottom line. So I just talked to a business owner about this, and they're looking at the program, looking to do it. And within 3 years, they're going to have a new truck paid off. And that new truck has created 5 new jobs. So this is really a great way to help businesses grow. And then from there, it's a census. We'll sign agreements, but this is the implementation steps. But one thing I want to mention is for the independent brokers that are out there right now listening, we want to work with you. This isn't exclusive. We want to partner with you. We want to help you help your clients. As a broker, it's your job, it's your responsibility to come to your clients with solutions to help them. And right now, their challenge is the rising costs of healthcare. So you always want to go with them with the solution rather than have them come to you with the problem. So, I would recommend, talking to us. And obviously, there are perks involved for brokers. You will get compensated. And what this does is it offers you a way to go in there and show your value to your clients and say, hey, look, I am looking at new and innovative ways to help your business grow and to help your business save money. And I truly do have your employees' best interest in mind. And for business owners that are out there listening right now, give us a call. This is a wonderful opportunity to go ahead and learn how we can help you. Like we mentioned before, we might not be able to help you with everything, but I guarantee you we'll be able to help you with 1 or 2 things. So with that, I would like to thank everybody for listening. Once again, I would like to thank the Milford Chamber and Simon, and obviously Steve Glick and my partners here with the Flashpoint program. So any questions, I'm sure we'll be sending out our emails after this presentation. So I look forward to it. Thank you very much for your time. I'll turn it back over to you, Steve.
Yeah, if I may jump in.
Sure.
Steve, I just wanted, this is David Middleness again. Steve and I have worked on a few cases together, and what we're seeing in the marketplace is, as far as participation, so people out there listening think, this doesn't sound like anything my people would, this sounds confusing, my people wouldn't want to do it. We're seeing 86% of employees that are eligible for this program participate in it. That blows away the normal 30 to 35% that you get in regular voluntary enrollment. People see this, they understand it, they get the value of it, and they participate in it, and they love it. 86%
Absolutely.
enrollment rate. It's unbelievable. So I just wanted to add that in there. So
yeah, thank you for that, because it is an unbelievable number. And it truly does show that we are helping the individuals. When you talk about, financial protection, protecting their families, that's concern number 1 for each worker out there, whether they're protecting themselves or their family's financial security. So thank you for bringing that up, David.
Okay.
Thank you.
So next on our docket, we have Dina Erickson, who, as Steve Glick was talking about at the beginning of the program, is in charge of PBIRX, which is a pharmacy benefit intelligence, which is what they live and what they deliver. So without any further ado, Dina?
Great, thank you so much. It's a pleasure to be here today. Thank you everyone for joining. My name is Dina Erickson. I'm Director of Partner Relations at PBIRX. And PBIRX is a pharmacy benefit consulting and auditing firm. And we're actually local. We're located, headquartered right in Milford, Connecticut on Wheelers Farm Road. And we've been doing pharmacy benefit consulting services since 1990. We have a team of pharmacists, and our clients generally see upwards of 40% savings on their pharmacy benefit spend annually by utilizing PBIRX services. And we're so happy to be able to present today two options that are going to be available for all chamber members. And as Steve had mentioned earlier, these are free of cost, so there's no charge for these services. And what we're going to be offering through the Chamber Insurance Trust to all chamber members is our pharmacy discount card and an individual international RX program. So what we'll do is we'll talk a little bit about the pharmacy discount card first. It's very, very simple to use. You will get a little pharmacy discount card, and you basically, when you're going to fill a prescription at your local pharmacy, you just show the card, and on average, you'll save 15% on brand name medications and 55% on generic medications. And this is accepted at over 80% of the pharmacies nationwide. So some of the big ones will be CVS, Walgreens, Rite Aid, Target, Stop and Shop, Walmart, those places that you're all familiar with filling those, filling your prescription drugs at. So again, very, very easy to use. You simply just show the card at the time that you are filling your medication. It doesn't matter if you have insurance and you're running it through your insurance plan, or you don't have insurance, you can use it either way. And you also are able to save, in addition, on prescription medications. You can save on diabetic supplies, smoking cessation, durable medical supplies, and also pet medications. So that's kind of neat as well. If you have a pet that needs some medication and you're picking it up at your local pharmacy, you can also get a discount on that medication as well. The next thing that we're going to talk about is our international RX program. And this is, I believe, a really, really great benefit that not a lot of people have access to, but now you're all going to have access to. And basically, this is going to enable you to purchase your brand name medications through international channels. And we have partnerships with Canada, Great Britain, Australia, and New Zealand. And basically the way that it works is you'll have a toll-free number that you'll be able to call into, and the customer service rep will basically help you with the entire enrollment process. So during that initial call, they're going to talk with you about any medical conditions that you have, any current medications that you're taking. So you should always have a list of any current medications that you're taking to share with that person, because they're going to want to check for any drug interactions or allergies and know all of that information when you first call in. And then the second step to this is to have your physician prepare a prescription for you to send out to the toll-free fax number to get that filled. And you're going to want to have 3 refills, because it's usually a 90-day supply that you'll be receiving at your home. And once that happens, they enroll you into the program. We suggest that you have a 30-day supply of your medications on hand, because it does take about 5 to 15 business days to get that initial prescription filled. But once you're in the program and you have that initial prescription refilled, those refills will be sent to your home, and you won't have that long of a waiting period. But it's just good the first time that you're using it to make sure that you do have at least a 30-day supply on hand based on the timing for when you're going to get that prescription. And another important thing to mention is that these are all brick and mortar stores in these other countries. So it's just like if you were going to CVS here to pick up your prescription, it's the same type of pharmacies in Canada, Great Britain, Australia, and New Zealand. And all of the medication that is sent to you is in the original manufacturer's packaging. So you'll be able to see that when you receive that prescription. And we've already run a couple of these through for members who have called in and had questions. There was one example that I always use because the savings was actually pretty incredible, and it was for Xarelto. So we had a chamber member who had called in and said, oh, can you price this through the International RX program? Because I'm paying about $1,400 for a 3-month supply, I'm sorry, a 90-day supply. And so we ran it through the system, and for the same prescription, it was going to be $500 for a 90-day supply through the International RX program. So if the member chose to go ahead and purchase this through, it happened to be Canada in this example, that was a savings for that member of $3,600 a year. So that's actually pretty impressive. And again, these are voluntary programs. There's no cost to you for these programs, so you can feel free to use them whenever you'd like. And I'm sure that people are going to have a lot of questions, so I'm sure that we'll get contact information out. Any type of follow-up, we'll be happy to help you with that. So thank you.
And if people want to put questions into the Q&A, we can do that, and we'll answer all the questions at the end. So feel free to type your questions into the Q&A portion, and I will go through those and read them to the panelists as you specify. The last person we have presenting today is Lee Sirota, who is the president of Dental Benefit Management, which works differently than service corporations and insurance companies by creating and offering dental plans that treat both dentists and members fairly and are affordable and value orientated. Dental Benefit Management continuously refines their approach to preserving the desirable features of traditional dental benefit administration systems while eliminating unnecessary cost. So Lee, go ahead.
All right, thank you. I'll share my screen. Hopefully everyone can see that. So thank you. Very pleased to join you today. And we've known Steve Glick for quite a long while. We're a regional dental accountable care company. We've been in operation since 1979 and in Connecticut for the past 37 years, and created some innovative product offerings with Steve Glick's help and the help of the Chamber Insurance Trust. We're able to underwrite group dental benefit plans for the association as a whole, which allows us to price the plans as if they were priced for very large employer groups and make those products available to smaller employers at large group rates that they would find difficult to access in the market generally. And as Simon introduced me, we take a very different approach to operating dental benefit plans as an accountable care company. I'll describe a little bit about how we do that and why, if I can get my slideshow to advance. Our premise is fairly simple. We want to make the population that we serve healthier. And that is a mechanism through which we improve efficiency, we eliminate overhead, we optimize the care delivery through a data-driven model, and support that with a very accessible, broad networks of dental professionals, and then maintain sort of collaborative relationships and a sort of high touch approach to client services for all of our constituents, really to drive home the importance of oral health, the usability of the plans, and help people become healthier. One way we do that is through care optimization. This is essentially a model that allows us to come to a consensus with the dentist on what is appropriate, what is necessary. And we hold all of our providers, whether they participate or not, in our programs to the same community prevailing standards of care. We again apply predictive modeling to understand need, and then hold participating dentists accountable for the cost and appropriateness of the services that they deliver to their patients, our members, which serves to reinforce or strengthen the relationship that patients have with their dentists. When the health plan is supporting the treatment plans that the dentists are proposing and paying for it or helping to pay for it, it sort of underscores the necessity of the care. And what you like to say that we always pay for what our members need, but we want to be certain that our members actually need what it is we're paying for. Over time, this can have some significant impacts on the members' costs and the plan sponsor or the employer's costs as employees or the population moves from urgent and emergent care, meaning they only go when it hurts, to having routine preventive services. Prevention is cheaper, and that is reflected in stable costs in the premium. And I think Steve Glick can attest to the rate stability we've managed to apply over the last few years that the chamber programs have been in place. While members are still accessing and receiving services and having their accumulated neglect or unmet needs addressed and lowering their ongoing out-of-pocket costs relative to dental care. Simply, once you are in oral health maintenance status, you're much less likely to need costly treatment services that have high coinsurance or co-payments or are subject to deductibles. So it's a strategy to both improve people's health outcomes and save money over time. We have pretty broad networks in the Connecticut region, and we maintain network access that looks more than just the numbers of dentists that participate. We look at their geographic distribution to ensure that 90% of our members have access to a dentist within 10 miles of their home. We look at the capacity of the network to serve members. So 98% of our dentists are accepting new patients, not a situation where you can enroll in the plan but not find anyone who will make an appointment for you. And then we hold them to access and appointment availability standards through our contracts. So it's not useful to have a plan that you can't use and use when you need to use it if the dentists aren't making themselves available to provide the services they're contracted for. And again, we support this with what we like to call our 360-degree client services model. We have a hiring standard for our representatives. They've all worked in dental offices. So we let the dentists train them on dentistry. We teach them about dental benefits and insurance. And their model is to be able to see everything. So we never send anyone to voicemail jail. We never transfer anyone to different departments. There's no need to do that. Their role is to provide the first contact resolution for members to help them access services, to our dental office partners to help them understand the benefits that the members or their patients have, and to brokers or consultants to get everyone on the same page in terms of coverage, what the policies cover, and how the policies function. So why should employers support their employees having dental benefits? In the United States, emergency department dental visits account for $1.6 billion of healthcare spending annually. And that's wasteful spending because no one can get dental care at an emergency room. Often you're just given a prescription, maybe pain medication, and told to go see a dentist. So without the benefit of a dental benefit and access to an accessible network, a lot of people misdirect their care needs to the emergency department, which is very costly. And that's a driver for medical premium and members' cost shares. Very significantly, the Centers for Disease Control recently reported that they calculate $45 billion in lost employee productivity related to dental issues that have been untreated, meaning unfilled cavities, infections that require treatment, and certainly, providing a benefit that allows your employees to have necessary care could mitigate some of the lost productivity. Lost time out of the office when someone has an emergency and has to rush to the dentist, I think, is the likely cause of that driver. And then nationally, organizations have calculated that the cost of dental disease is $422 billion a year, which produces $144 billion worth of absenteeism. I think the message we're espousing is that oral health is a component of overall health, and that you should think about it and the benefits you provide to your employees in that context. It's part of healthcare, not just part of employee benefits or labor relations. And it could have some profound gains in more productive and more present staff. And we certainly see that in our organization. So we've created a portfolio of plan offerings for the Chamber of Commerce Association through CIT that is offered on a private exchange basis, meaning each employee can choose the plan design that is right for them based on their perceived need for services and coverage and or cost. And this is available either on a employer paid or an employee paid basis. We're agnostic as to whether it's a voluntary or contributory benefit. And our plans are designed to be very high value coverage, but also consistent with coverage expectations that people have come to have over time relative to dental benefit plan designs. And so I would suggest, as Steve Riggs mentioned, this is designed to be broker agnostic. So you should certainly ask your benefit advisor to compare these to the current coverage you may have, or explore this if you don't have dental coverage today. Thank you.
Thank you very much. So this exciting seminar is pretty much at an end, and I offer, if anybody has any questions, put them into the question and answer section, and I'll be happy to direct them to the appropriate person. If nobody has any questions and you've all heard enough, it could be time to say goodbye. So I don't see any questions coming up right now. I think that means that all of our presenters did a very good job explaining what they do, and everybody's going to get phone calls after this. So
I would like to say,
please, Steve.
Thank you to all the people. But again, we need you guys to really look differently. This is not available on a general market condition. This is important, that you take a new look at healthcare. It isn't just the price of the health insurance. It's a total package with a lot of value and direction. So we look forward to helping you. We hope that we can double and triple the membership of the Milford Chamber of Commerce. So thank you all for taking the time today.
Thanks again, Steve. And thank you for all the participants and the panelists. Great job. And I will get this recording onto our YouTube channel post haste. So thank you very much, everybody. Have a great day. See you soon.
Thank you.
Thank you.
Thank you.
Thank you.
Okay. Bye-bye now.
Bye.